Hi, I'm Dr. Clara Scott. I'm the steward of My Family Vet, and I want to go over the pre-anesthetic sheet regarding anesthesia and what's important for your pet. So I want to speak about the pre-anesthetic surgery form. This is an incredibly important form that we use every day at My Family Vet, partly because we're allowing the client to take some responsibility in the things that we're doing to the patient. This is about understanding what each part of the sheet is asking you to consider. So one of the first things on the sheet is an examination. If the pet hasn't been examined in the last 12 months, then absolutely we need to look at the pet and make sure that our heart is healthy, that we don't have skin conditions or extra lumps or whatever's going on with the patient as a whole. And so this is truly incredibly important to have done by the veterinarian prior to surgical procedure if it hasn't been done recently. That's going to give us a physical overview of the patient. When we think about blood work tells us the functionality of each organ. So the mini panel gives me 2 liver, 2 kidney, total protein and glucose, plus all my reds and white counts and platelets. So bleeding disorders and trouble with internal organs. The more comprehensive diagnostic profile gives me those same bits of information, but a little bit more. It gives me calcium, which goes up with cancer. It also gives me amylase and lipase that tell me what the pancreas and kidney are doing. So it gives me just a little bit more information than the smaller panel does. But both are incredibly valuable to assessing the functionality, the internal organs of the patient. The third thing on this sheet is speaking about rabies. Now, rabies is a liability injection. Rabies is still in the Texas environment. It's mainly a bat-derived rabies, but it's one of those things that can be killer to both animals and humans. So by law, we want a rabies shot on board. Intravenous fluids help maintain the blood pressure of the patient. They help replace volume load if the patient is losing blood. So IV fluids are incredibly important if I have elevations in liver or kidney enzymes, if I'm going to have a lengthy procedure, if I want a direct line to the heart. So if it's a short, quick procedure, it's not as pertinent to have IV fluids, but if we do have a longer procedure or an abnormal procedure, something not routine, I highly recommend having IV fluids on board. It involves the placement of a catheter, an extension set, and a bag of fluids. So that's what's involved in the cost. And so your dog or cat will go home with a shaved leg if we do place IV fluids. Pain management. This is something incredibly important to the team and to the patient and to our pet owners, trying to manage pain. And there's different ways to manage pain, both through analgesics as well as anti-inflammatories. So we always choose what's best for the patient. If there seems to be pretty extensive pain involvement, like something orthopedic, then we'll do both anti-inflammatories and analgesics to help them. So our choices there are kind of based on blood work as well as what procedure we're doing. But we can always ask for more if the time frame that we've sent home is not enough, but pain management is vital. They all get a buprenorphine injection while they're on the table, so that aids in the recovery process as well as making sure they don't feel anything for the next 12 hours. ECG is a screening to kind of give us an idea of what's happening with the heart. There are certain breeds that have a predisposition to heart disease. King Charles Cavalier, Rottweilers, Bulldogs, and there's a few others as well. So if your dog has a history of heart disease and you want to see, hey, can we handle anesthetic? That is a very inexpensive ECG evaluated by a board-certified cardiologist with a report to tell us, hey, we should be able to handle anesthetic. So cold lasers are a non-invasive therapy that help reduce inflammation and decrease the healing time. So it's something that we can do post-procedure to help the patient heal quicker. So it doesn't hurt. It is a light source that's put on the patient when the procedure is over. Home Again microchip implantation. This is vital to all pets here that come here to My Family Vet, because I never want that bond to be broken because of loss. So we see lost pets all the time on Nextdoor and information coming through the internet. This is a way to get your pet back, whether or not the collar is on them or not. You should have a collar with your phone number, but a way to always have information within the pet is making sure that they're microchipped. So microchips are offered during the anesthetic procedure because it's a little bit bigger needle when you give that microchip implant. E-collars are ways for the patient not to mess with the stitches. So if you have, and most of us know our pets, so if you know your pet's gonna mess with the incision, then get an e-collar. This goes around their neck, it does not hurt. It's a little bit of a nuisance for the next 7 to 10 days, but it allows the healing without the pet, messing with it. Baby teeth. Baby teeth are oftentimes found during spays and neuter time, so deciduous teeth are what are called baby teeth. Small breed dogs are notorious for retaining their deciduous teeth, so it's something that we check for at the spay or neuter time to make sure that we get those, because the baby tooth will end up rotting out the good tooth. So that's why we check for those at the time of procedure. Last but not least on our pre-surgical form is if there's any vaccines that you would like done while the pet is with us here at My Family Vet. Part of that's to save you a trip. Part of that is so that we can do them when the pet's not feeling anything. So just know that that's offered for you to be done while they're asleep. So that saves you a trip. That also saves the patient any discomfort. The pre-anesthetic sheet is an incredible form to have open communication. So these are ways that you make decisions about what you'd like us to do. It's also a way to help control cost, but it's also a way for us to practice top medicine. So here at My Family Vet, we want to offer you the best, but there are some things, like for example, you're not going to get a microchip but one time in the pet's life. It could be that it's a very short procedure and you don't want IV fluids. These are all choices that I allow the clients to make so that they can choose what they feel is best for their patient, but things are always open for discussion. If you have any questions on the sheet, we need to speak to a technician or the doctor that's doing the procedure so that everybody's on board on what you're signing and what you're doing so that we make the right decisions for your pet. But each case is taken individually. Even if we consider something a routine procedure, nothing is routine when it's your baby.